What's up, everybody? Welcome back to the Dude Nurse Show. I'm your host, the Dude Nurse, and today we are going to talk about a few more myths in healthcare. If you had listened to a previous episode, I did an episode regarding myths in healthcare, and I've had some questions and seemed to stir up a lot of conversation about more myths in healthcare. So I thought I would kind of do a follow-up episode to that. And so today, what we're really going to talk about are really just kind of two main myths. The first myth that I want to talk about, and this one can be really dangerous. A lot of times people will be on a particular medication, say insulin or an antihypertensive, something, for their high blood pressure, whatever the case may be. So what people will sometimes do is they say, well, I'm going to go out tonight, got a plan with the fam, going to go to my favorite restaurant, and they got that, double deep fried, chicken fried burger, and, just a really unhealthy meal. So they decide, instead of 10 units of insulin, I'm just going to go ahead and double it and take 20. So that way I'm covered, I'm good, don't have to worry about anything. Folks, that is bad. Bad. It's bad for several reasons. Number one, it is not recommended that patients self-medicate, i.e. adjust the dose of your medication. Medications aren't given so that we can give in and eat more and take more. It doesn't work that way. We need to take our medications based on how they're prescribed. Number one, it's extremely unsafe for a person to take it upon themselves to self-medicate. Number two, you will run out of your medication sooner than you're supposed to. So then when let's say you are given a 30-day supply and you run out of it in 18 days. Well, you still got 12 days to go. And your prescriber, they get notified, especially if there are no refills. Even if there are refills, the pharmacy will kick it back as too soon to refill, because based on the directions on the medication, it's not time to refill. So you could really wind up in a bad way if you're not taking the medications according to your prescriber's instructions. Three, as I mentioned before, it's really unsafe. If you double dose your insulin or your whatever medication, if you're supposed to take 50 milligrams of metoprolol and you take 100, you could have some really bad side effects. Our doctors and nurse practitioners, etc., write us these medications based off of what they perceive in their assessment to be medically warranted. And so, if they wanted you to be on 100 milligrams, you'd be on 100 milligrams. Just because you want to eat more or not, maybe not exercise or whatever, that's on you. But, you really need to be mindful of how you're supposed to take your medication and not take it the way that you want to take it, okay? The other myth that I'd like to talk about is one I hear a lot, and you hear it all the time right now, especially in, we're coming up on another presidential election. People say it all the time, why can't we get universal health coverage? They have it in Europe, they have it over here, they have it over there. Well, or people will say, oh, they have free health care in Europe. Folks, it's not free. They get the hell taxed out of them. I mean, they're taxed at 40 and 50%, so it's not free. And the other thing is, I was over in Europe last year. I was over there for about 9 weeks, and I went to the UK and various other countries, and talked to people who are part of that type of healthcare system. One of them is like UHS, Universal Healthcare System. And there's a lot of things that are problematic about that. The consensus that I got was that if somebody has any type of means, they have private health insurance. So even though they're paying for this universal health system, this universal health coverage, this free health care, they're still paying for a private policy. Why? Because the universal health system is pretty shitty. There's usually very long wait times to get in and see doctors, not just specialists, but regular providers. And financially, the universal health system is not doing very well. When I was over there, like in the UK, it was on the news just about every day. I heard it on the TV, talking about how they need more money. They're financially or becoming financially insolvent, and that's a big problem. Over here in America, we have this illusion that everybody can have free health care because it works over here, it works over there. Yeah, but that's not the entire picture. And saying that it works is kind of misleading, in my opinion. It doesn't really truly paint the entire picture, because yes, people have access. Everybody is given the access, not necessarily through their employer, as is the case in the United States. That or Medicare are usually the two biggest providers of health insurance. It's supplemented through your employer, or you get it through Medicare or Medicaid, some type of program for indigent folks. But over there, theirs would be more akin to like a Medicare system, but they still have another level that if people really want good care, be able to go to some of the top hospitals, etc., they're going to be paying for a private plan as well. So, it's not just us needing to just offer free health care, or, we would have to overhaul our entire economy. We have a capitalist economy. They have a socialist economy. So it's not as easy to implement as people might think. Not to mention, when you start, driving down some of the factors where, doctors and surgeons and all these people that go to school for, 10, 12, 13, 14 years to learn how to do these amazing life-saving techniques, where's their incentive? What's the incentive for them to spend, 12 to 15 years of their life in school, in fellowships and in residencies and training, in order to come out and make $40,000? That doesn't make sense. Nobody would want to do that. So I'm not too sure on the financial side as to what they make, but I can tell you that the doctors over there don't make what they do here. And some people will say, well, money's not everything and blah blah blah. Shut up. I've been poor before. It sucks. Just look at me. Nurse practitioner. I spent 6 years in college, plus several thousand hours doing clinicals and rotations and stuff. You can't just snap your fingers and pop out a nurse or a nurse practitioner or a PA or a social worker. These things take time. You have to study. You have clinical hours and supervisory hours that you have to obtain in order to move forward in your practice. And what does that mean? There has to be someone there willing to take you on and supervise you. There's inherent liability with that as well. So, I just kind of wanted to touch on that. A lot of people think, oh my God, healthcare is so much better over here. It's so much better over there. But, in a lot of ways, or in some ways it is, but in some ways it's not. I do think that we could certainly cut our costs, and I don't just mean doctors and nurses' salaries. I don't want anybody cutting my salary. But I do think that we could focus on more prevention, focus on having doctors and healthcare clinicians really being held accountable for certain outcomes. They have something kind of like that in place, but I think it could be a little bit better. You know, there's a lot of things that, like Europe, for example, do really well, and we could learn a lot from them, but then vice versa. One of the other things too, when I was talking about cost, is that, you know, the United States, we spend more per patient than like the next 3 industrialized nations combined. So, and we don't have the best outcomes across the board. There's other countries, like I know at one point in time, Cuba had lower infant mortality rates than we do, you know. So we have to be able to kind of bridge that gap, and one of the things that makes that gap that much more difficult to bridge is the fact that there's so much redundancy in healthcare. You know, I know you guys hear it, you know, the nurse, the doctor, everybody, you know, asking you the same question 10,000 times. It's not so much that they're double and triple checking, it's in the chart, people, it's in the chart. But there's just, you know, they have boxes they have to check on their forms, we have boxes we have to check. And it's really stupid. We spend more time checking boxes and doing paperwork than we spend with the actual patients. You know, we get tunnel vision, we get so task oriented that we forget the big picture. We can't see the forest for the trees. We're so focused on checking all these damn boxes, and the patient care has just been pushed to the side altogether. And it's really awful because, you know, we are one of, you know, arguably the greatest country in the world. We have some of the best and the brightest minds. I mean, you know, look at me, I'm here. Just kidding, but not really. I'm pretty fucking smart. You know, we have some amazing institutions. I mean, here in Houston, Texas, we have the Texas Medical Center. It is world renowned, the biggest and the best medical center in the entire world. People come from every corner of the globe to be treated here in the Texas Medical Center. So we have what it takes, you know, but as a society, we don't really place much of an emphasis on prevention. So, you know, if we want to be more like Europe and have, you know, better outcomes and have more health care and whatnot available to people, we need to tighten up our belts, become more efficient, decrease redundancy. We need to place a strong emphasis on prevention, find a way to monetize prevention, because there's no money in prevention. There's money in treating. You know, if I could prevent you from ever getting diabetes, I mean, I could make hundreds of thousands of dollars off of you, maybe even millions, depending on if you had to have a surgery or an amputation because your circulation was poor. I can, you know, as a facility or even a provider, as an endocrinologist, I can make a ton of money off your diabetes. I wouldn't make very much if you never got diabetes. So that would be great for you, maybe not so great for me. So I'm not saying that doctors want us to have diabetes and have high blood pressure and all these other things, but I think that if we could find a way to set up more prevention-focused outcomes and drive revenue that way, I think that might be a viable option. But I just wanted to, like I said, to touch base and update a few of those myths. It's been a while since I had done a show. Missed you guys. 2020 has been an absolutely crazy year. But stay tuned for the next episode. We'll talk about some more interesting stuff. Hope you guys are doing well, staying safe out there. Until next time, the Dude Nurse out.